Hello everyone. My name is Brooks Fowler. I'm going to be discussing this week on access to healthcare and cardiovascular health and going into specifically Greenville County. Okay, so social determinants of health. Major determinants of health can be broken down into four different categories. I feel like in order to understand what we're going to be discussing, this is important to break down. So, four different categories: environment, lifestyle, heredity, and medical care. So, environment, that is your physical, socioeconomic, political, and cultural environment that you grow up in. Lifestyle could be behaviors such as smoking, um, sedentary lifestyle, things like that. Heredity, genetic factors, which self-explanatory there. Medical care, and that would be access to medical care. So, a great video are from last week's material, which I have to bring up again, which I think was great, was Veronica Scott Fulton in her TED Talk when she discusses social determinants of health. And I really feel like she put it in a great perspective. And, you know, if you could pick your parents, right? So social determinants are normally not things that you can kind of decide. They're just what you're born into, which in this county, we're born in Greenville County, and I will be discussing those some of those determinants there. Okay. So access to care. Like social determinants of health, access to care is a part of that. So these are best predicted by race, income, occupation, and geographical areas. Now, these all kind of work together or a little bit against each other in combination, and they to access to care. So race, income, occupation, and geographical information, such as a minority in a rural area that is a farmer. So that person is going to have less access to care than someone who has a corporate job in the city. Okay, that's the best way I can explain it. Um, Now, if we look at access to care in Greenville County, also I want to point out healthcare costs in the U.S. are the highest in the world. So income there, that is something important to look at. So this week's question, one of them is, are there healthcare providers in your county? So with access to health, we have to look at, do we even have healthcare providers? Yes, we do have healthcare providers. We have a lot of them. Now, is it um, now they are divided though. They're divided by your income. So we have access as far as location. In this county, we have access, but there are limitations to that access, such as, like I discussed before, income. So I thought this is very interesting, or something I'll point out later. But according to the United States News and World Report, 13.3% of Greenville County's population does not even have health insurance. So um, you can, of course, go to a hospital, an ER, without health insurance. Um, but in Greenville County, there are two major systems. You have your Bon Secours and your Prisma Health. I also put Shriners there, but that is a specialty children's hospital. And I'm kind of just wanting to focus on adult care for for these purposes today. So for your insured or the population in Greenville County who is, say, employed with health insurance full time, you have more options. You have the vast variety of family practices within the hospital systems in the county. Now, you're uninsured. There are resources. that I've found. Now, I don't think that that is widely knowledgeable. I don't think I had to go and research this. Like, I didn't even know that this existed. And I have been without health insurance. I have personally have. I grew up without health insurance, going to the health department to get my vaccines. So I think some of this can is just lack of knowledge as well. So I put something interesting I found. Access Health, which is a partnership with Prisma Health, where trying to connect low income uninsured residents of Greenville County to a medical home or a primary care. So this is a service, which I have the link here, that you can go and apply, to find health resources. Other options, there is the Greenville Clinic, Greenville Free Clinic. There's two locations. They actually provide general medical services, dental services, health education classes, and an in-house pharmacy. DHEC is another thing that I have mentioned. We have a brand new one as of 2022, I believe. It just opened last year. 30,000 square foot, 150 DHEC team member located off Halton Road. It's also connected to the Green Link Transit route, which is the local bus route. It provides access to public services, preventative health, immunizations, and family planning. So that is an important resource there. Okay, so now that we have identified the access in Greenville County, I wanted to look at, or this week we're looking at cardiovascular health in particular. So according to South Carolina DHEC, South Carolina overall in 2020 was the leading cause of death. The risk factors that I found for South Carolinians were smoking, diabetes, high cholesterol, overweight, sedentary lifestyle, and hypertension. So I also have on the right-hand side of this screen, Greenville County in particular. I have percentages there where I found from the United States News and World Report. The heart disease prevalence in Greenville County is 5.6%. And then I also listed the ones that I found for obesity, smoking, and diabetes for the county in particular. So what health access and quality issues contribute to this issue? So if we're talking overall, go back to access of health. You have, you have your geographical location, which Greenville County is somewhat metropolitan. Income, which we discussed, 3.3% have no health insurance. Greenville County's poverty rate is also 11.2%. I did add in transportation. I found, and this is all from the same website, United States News and World Report, that households with no vehicle, 5.4%. Now this may seem low, and I want to bet that this is there's probably more. And the only public transportation we have, I believe, is the Greenville Link, which is the free bus, here in Greenville County. So overall, I would say reasons for healthcare quality access would be your income. To me, that's really what sticks out, is income. And I also think that lifestyle choices, as the previous slide, for smoking, diabetes, obesity, I think a lot of these things also contribute to this cardiovascular issue in the county. Now, what would be the best thing to do would be, everyone gets health insurance. We all have coverage, but then in a real world, that's probably not going to happen in the US at this point. We don't have universal health care. I think the biggest thing here is is from what I can tell is just spreading the word for what we have for options. So we do have free clinics. We do have connections for low income and uninsured residents. The Greenville Free Clinic offers health education classes that include um, things like, blood pressure regulation, diabetes education classes, things like that. Those are free. But the word needs to be spread. So overall, I think we have it. We have, options, but there needs to be education. There needs to be more spreading the word, getting it out there, and just overall knowledge of the situation. So here are my references here, and I'll also post those as well.